Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple-board certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, it's Dr. Lederman. Here we are at Radiosurgery in New York. It's WABC studio. I'm here with Ariel Lederman. Hope you're all doing well and had a great week. We have a lot of things to talk about today, and we're here to talk about events of the week and patients and cancer news.
So good morning, doctor. What have you seen this week?
Well, we've seen a lot. There's a new article that was published in New England Journal of Medicine.
I hear that's a pretty big journal.
It's probably considered the most prestigious journal, and there's a new article that looks at urologists, who are doctors, surgeons who treat urologic problems and prostate cancer, who analyzed the use of radiation when they profit from the use of radiation. I think we don't hear a thing.
So that's kind of like a patient comes in to see a urologist because having some symptoms, and the urologist says, use my treatment, and they never get a second opinion?
Right. Well, often the urologist sees the patient for a biopsy. So the urologist is the first one to see the patient for a biopsy. And often they form an intimate relationship because of that biopsy, and then the patient relies on what the urologist says. We're here telling people get a second opinion, because if you get a second opinion, you have a better chance of learning about other options and getting the best possible treatment.
And a new set of eyes will look at your condition or whatever you have.
So now, over the last few years, urologists have been buying radiation centers.
So they can
profit from the use of radiation. So historically, urologists encourage people to have surgery, historically, more or less.
Because they did the surgery.
Yeah, more or less. And historically, radiation oncologists encouraged men to have radiation for the prostate cancer.
Yes, because they believe that was better.
Because they believed it's better. And we believe if you look at the data in our hands shows marked improvement. And in fact, we have a booklet that we send out to patients at no charge, and it shows our results, my 3,000 patients versus major centers across the country, and what happens to those patients.
So do you have any numbers? So those patients must do much better. Do you have any numbers?
Patients who come to us do much better. But the point of this article is, if urologists buy radiation centers, they start increasing the amount of radiation they use. So it means that if they profit from surgery and if they profit from radiation, all of a sudden their use of radiation goes up 200, 300%.
Wow.
So it kind of tells you that if they profit from one and profit from the other,
they're going to use radiation.
They're going to use radiation. Why?
They probably think it's better.
They probably think it's better. So that's not what the article says. The article is saying that urologists are just doing it for the money.
But if you look at it, if you have both options, you can give option A or option B, and you can do whatever you want. They're going to go with the radiation.
Right, but they go with the most expensive form of radiation. Intensity modulated radiation is like 9 weeks of radiation. You talk to prostate cancer patients, and many, many of them will tell you they're going to have 9 weeks of radiation. Well, 9 weeks of radiation isn't the best. In fact, most men, it's not the best at all. It's just the most expensive. And what this article is talking about, and what the world's talking about, is, are we looking for the best treatment or the most expensive treatment?
We want the best treatment.
Yeah, we want the best treatment. And it isn't the best treatment. It's the longest treatment. It's the most expensive treatment. Yeah, it makes more money for the person that owns the radiation center, like the urologist, but that's not really what we're talking about. We have men who come who can have treatment in 45 minutes. You can have one treatment in 45 minutes, be done with your prostate cancer treatment, go home, go back to work, and feel fine. And it costs less than half as much. It's less toxic, less side effects, less radiation exposure.
And how are the results?
The results are fantastic. But the problem is, since so many urologists are owning centers, that it's pushing more practical, more economic treatment out of the way.
Also, if anyone has any questions, you can call us in at 212-CHOICES, 212-CHOICES.
Or you can call us at WABC Studios, which is at 800-848-9222. 800-848-9222. So anyway, this article is very interesting. I just want to give a synopsis of it. It's in New England Journal of Medicine, dated October 24th, 2013. So that's 2 days ago, right?
Yes, a couple days ago.
Okay, and this doctor, Dr. Gene Mitchell, looked at Medicare claims from 2005 to 2010 and put together basically two different groups. Urologists that referred to themselves for radiation.
So the urologists who own centers or part of groups that own centers.
Who profit from the radiation, and urologists who don't. So there were 35 self-referring groups, 35 non-self-referring groups in private practice, and also there were academic centers as well. 11 academic centers. And they evaluated the use of intensity modulated radiation therapy, this 9 weeks of treatment for patients who were having prostate cancer treatment. And the rate of intensity modulated radiation therapy by self-referring urologist increased from 13% to 32%. So that's almost a 200% increase, meaning 300% rate higher than otherwise. That's if they profited from the radiation. If they didn't profit from the radiation, the use of intensity modulated radiation therapy went from 14% to 15%. So clearly there was one thing that changed.
Who was referring to who?
No, who was profiting from who?
Who was making money out of it?
Yeah, who was profiting from it? So when the urologists would profit from it, the rate of radiation use went way up. And the whole point of this is get a second opinion. Find out what's best for you. You don't want to find out what profits your doctor the most. You want to find out what is best for you.
Yes, and that's why you should, yes.
That's why we encourage men and their families to call us up, to let us talk to you. Best is to meet you and to find out the best option for you, whether that IMRT, which usually we don't say is because we don't believe that it's the best treatment, brachytherapy, watchful waiting. There's other treatments out there that we believe are better.
And sometimes you don't need any treatment.
We had a patient last week who just brought us a bushel of apples. He was so happy that he could go home feeling great, didn't need a biopsy, had a low PSA, even though the urologist was pushing him for a biopsy and probably treatment.
And most likely he will never have any symptoms from his...
He's very happy. He was very, very happy. So, again, the answer is if you have questions about prostate cancer, please give us a call. We don't own urology centers. We have no hidden agenda. We just do what we do, which is trying to provide the best possible treatment for each person. So what do you know about e-cigarettes?
E-cigarettes?
Yeah.
It's not like email.
It is not like email. It's less fun. But there's this whole new world out there of e-cigarettes. What is e-cigarettes?
It must not be as bad as cigarettes because it's got an E on top. E.
Well, I don't know. We don't know, and that's the whole point. Nobody knows. So there's a nice article in the journal called ASCO Post. And in ASCO Post, this week's edition, talk about e-cigarettes. Now, what is an e-cigarette?
It's an electronic cigarette.
Yeah, it's an electronic cigarette. The E stands for electronic. They're battery operated. They deliver nicotine and flavor and other chemicals. They turn nicotine into vapor, and they go into your body, right?
Yeah, they go into your body.
Yeah, so you're smoking this stuff. It's never been studied. It's not regulated. And the question is, what is it doing to us, and what is it making us a better country or worse country, healthier or less healthy?
Probably less healthy.
Well, I don't know. Some people use it to stop smoking. So if you use it to stop smoking, presumably smoking nicotine is less harmful than smoking tobacco. That's the idea, right?
Yes.
The problem is